Welcome to the complement learning system. This is the part 2 of the video. In part 1, we have discussed the general characteristic, and this part 2, I will describe the classical complement pathway. So, as we know, there are three pathways: classical, alternative, and lactin. And there are stages of complement activation. First, we have to understand that. So, first, there is starting of the pathway, or what we know as initiation of the pathway. The goal is to form C3 convertase. So formation of C3 convertase. After that, formation of C5 convertase. That is another major milestone. And finally, the main goal is to form this membrane attack complex, which I have shown here. Now, how it will start? So first, we have to remember that classical pathway, it is an antibody dependent pathway. So you always require antibody, and we know complement can bind to bound antibody only. So antibody has to attach to antigen. So antigen antibody complex is being formed. Once antigen antibody complex is formed, the first step is binding of C1 protein to this antigen antibody complex. But C1 is actually not one protein, it is actually three different proteins: C1q, C1r, and C1s. So C1q reacts with the Fc portion of either IgM or IgG. And C1, as you can see, C1q, it is actually hexamer. It has six subproteins. So 1, 2, 3, 4, 5, and 6. So it is basically hexamer having 6 globular head, and each head is acting as a binding site. Now here I have shown that it has bound to 2 IgG molecule. Now because IgG is a monomer, the minimum requirement to get activation started is that C1q's 2 binding site has to be occupied. So as you can see here, 1 and 2 are occupied. So now the pathway can start. So IgG, because it is a monomer, it has only one Fc portion. That's why you require minimum 2 molecules to start it. On the other hand, if IgM is there, which is pentamer, so it has 5 such monomeric molecules, so it has 5 binding sites, and that's why IgM is more efficient in fixing or activating the complements compared to IgG. And C1q requires calcium to bind this antigen antibody complex. So C1q binding to antigen antibody complex is calcium dependent. So once it binds, then it in turn sequentially activates C1r and C1s. Now, once this antigen antibody C1QRS complex is formed, it acts as a C1 QRS antigen antibody complex acts as a C4 convertase, and here usually 1 to 9 usually go in sequence. I have also earlier told you in earlier session also that if you want to remember this pathway, you have to remember that after 1 there is no 2, it starts with 4, and then sequence will remain as it is. So obviously this C1QRS, which has bound to the antigen antibody, will not act on C2, it will act on C4 first. So it splits the C4 into C4A and C4B. Now 4A is an anaphylatoxin. It is a smaller molecule. It will perform biological function. C4B, it is a larger molecule. So it will go and bind to this complex and join the cascade. So now we have antigen antibody C1 C4B, and this is basically C2 convertase, and it requires magnesium, so it is magnesium dependent. So after 4 you have to go with the flow, that is 2, 3, and after 3 there is no 4 because 4 has been utilized earlier. So now we have 5, 6, 7, 8, and 9. So that's how this pathways goes. So this C4B, which has attached to the cascade, will act as C2 convertase, and it will split C2A and C2B. 2B is a smaller molecule here. It has a bradykinin like action. It increases the vascular permeability. C2A is a larger fragment, and it will join the cascade. And now we have C4B2A, which acts as a C3 convertase, and it will act on C3, and it will split the C3 into C3A and C3B. C3A is a smaller molecule. It has a chemotactic and anaphylatoxic properties. C3B is a larger molecule. It joins the cascade. It acts on C5. It acts as a C5 convertase. So C4B, 2A, 3B act as a C5 convertase. It acts on C5, split it into 5A and 5B. 5A again smaller molecule. It acts as anaphylatoxic and chemotactic action. And 5B again a larger molecule, join the cascade, and once it is there, it attracts C6, 7, 8 and 9. Now 9 is a polymer, so all this protein C5 to C9, they get inserted into cell membrane of the attached to which the antibody is attached, and the complement system will get inserted into it and form a pore like structure through which all the cytolytic content will leak out. So this C5 to C9 is known as membrane attack complex, and that's how it performs the cytolysis. So that's about classical pathway. And now you know the sequence that after 1 comes the 4, then there is 2, 3, 4 already utilized, so 5, 6, 7, 8 and 9. So it is very easy to remember. Don't try to mug it up. Which one is a smaller and larger fragment? So I give you a clue that 3, 4, 5A, these are anaphylatoxic and chemotactic molecules. They are frequently tested in exam, and that's why they will never join the cascade. C2B has bradykinin like action, and that's why it is also a smaller molecule. So now you know the smaller molecules. So now what you have to do is just put the larger molecule to join the cascade, and that's how you remember the classical pathway. I hope that this is very clear. Now once this classical pathway is clear, in next session we will understand what happens if some of the proteins are absent or deficient, or if its regular protein are efficient or deficient, and how the pathogens can evade this classical pathway.